and welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, affectionately known for the last 40 years as the Money Lady, where I provide information, people, resources, insights into the challenging economic times we're facing today. And one of my commitments for 2024 was I was going to put much more focus on women and what women are doing in a pioneering role, as well as just life challenges. Like it or not, folks, women are actually statistically in the United States, we are the largest percentage of the population. And that is creating some very real transitional issues as we look at a country that's aging, that is more and more female, and the needs are changing because the population is changing. So guys, just move on over because you got company. My next guest today is a familiar face for the station, Dr. Anisha Singh, who is an internist. She specializes in internal medicine, and she brings a lengthy resume. You can certainly go and Google her to get more information, but her area, her sweet spot to me is women's health. And therefore, I'm going to be having her on often if her schedule will permit, and she's a busy lady, but because she has done so much work in the area of women's health, particularly senior women, of which I am one, believe it or not, I wanted to get her input. So today we're going to be talking on the subject matter of two things: why women are different from men in terms of our medical needs and requirements. And the second thing we're going to be talking about as a part of our general conversation, what a woman needs to look for when she's looking for a doctor. And so on that note, I'm going to introduce to some and bring to others Dr. Anisha Singh. Good morning.
Good morning. Good morning, Michelle. Thank you for having me here.
Oh, I'm delighted.
Yes, and I'm so glad you're bringing up women's and women-related topics to your platform.
Yes.
Much needed.
Yes.
Even in 2024.
Yes, it's way overdue, and I just think that it's about timing, historical significance, and let's just deep dive into this, if you don't mind. Let's talk about the first subject, and that is, how are women different from men in terms of their medical issues?
Yeah, good topic, because it's so easy to forget that. There was in medicine quite a bit for the longest time the understanding that the only difference between men and women was in sexual organs. And so a lot of research that was done in men, and everything was extrapolated to women. And now we are finding more and more that that's not the case. The different hormones affect the cell physiology. So women are not just different in sexual organs, but actually in cell physiology and metabolism. So whether you're talking about disease conditions, which then disproportionately affect women, or you talk about medications that then affect women differently, or how in a disease condition, for example, cardiac conditions, how does a woman show up with symptoms? All of that we are finding is so much different because our exocrine, endocrine hormones are all affecting not just the reproductive system, but also individual cell physiology. So all these billions of cells in our body, they're all getting affected, and our metabolism is different. So we need to look at women as a total, the gender and all the diseases, from symptomatology to the way the body responds to food, to exercise, to and drugs. Everything is different. So
that's very interesting that you bring that to the fore at this point in history. We are seemingly making progress in this area. Certainly, there's been a lot more emphasis on premenopausal, postmenopausal, women going through menopause, there doesn't seem to be um, the same knowledge level that we were dealing with even 10 years ago in terms of women going through hot sweats and even people making mockery of it. What are your thoughts about that?
No, there is, definitely a lot of unintended gender bias. When you look at a lot of conditions, right, like that disproportionately affect women, like migraines, endometriosis, there's so many conditions where even the funding for research is much less. If it's a disease affecting women more, there is less funding to those diseases. So that leads to an unintended gender bias in the medical field. And that then leads to this, calling a lot of other areas, especially you see in pain management, you see that in cardiac care, that there is, excessive amount of maybe refer to psychotherapy, maybe calling it an emotional issue, labeling sometimes IBS for everything. Um, when you can't understand it, it must be the woman. So there is a lot of, right now we have there is a website, the research, what's that called? The ORWH, that is the research on women's health, the Organization for Research on Women's Health. They provide a lot of free courses on sex and gender differences in medicine that are open to public. So we do have more and more, little more understanding, but when you think about it, it's not at all where it needs to be, because still majority of the research and majority of the education in medical field is still, the way it's given is, it's not gender specific. It's like based on a study that was done 20 years ago on males 6 feet tall.
It just sounds it just sounds bizarre. I must be open because research, particularly when you're dealing with the issue of male and female, I would think that one would want to focus on for clinical women. And I know we find the same thing now occurring with African Americans, where the standard has been white male 40, and without any concern or focus on the differences between African Americans and
Yep.
the population at large. And now we're dealing with a much larger base, which is women. And I must say that I am very blessed to have you as my primary care doctor. I don't make excuses. I am grateful, not to disparage male doctors, but I don't want them. Okay, because until a male has experienced what women experience every month as a normal, meaning if you don't have that, you're not going to be around. I'm not really feeling it. Now, that's a change because when my mother was my age, the gynecologist was a male. I mean, the fact that there was a female gynecologist was just very, very rare. You went to a male doctor, he did the exam, and today, I don't even know. Are there male gynecologists out here today, doctor?
Yeah. Yes.
Okay.
So if you look at it from the perspective of the physicians, and is there a difference between a male physician versus a female physician? There is, both ways. So when we look at it from the physician perspective, there are studies that show that the female physician sometimes whether it's in ER, the outcomes can be better. The female ends up spending 15 plus more minutes with the patient. So there is a bit of that, whether it's for a male patient or a female patient. But also, but when you look at it from the patient perspective, there is, about 46% of the women patients will say they are fine with either gender of the physician. 58% of male patients will say that. So from the idea is, if you ask the from the physician community, what we are wanting is more empathizing, more understanding. So if we bring more education to the medical school, to residency program about gender, and today you can have, unless the male community, the can stand up for feminism, for women. This, we will never win at this. So we don't want it to be a female and a male physician divide. We want it to be where, whether it is for female patients, whether it's in the area of female abuse or any kind of patriarchal, nothing can ever be broken without involving the male gender. So while there has been some research to say that female physicians have had, there are some more successes, but at the same time, the female physicians are also, after all, part of the same medical education system. So while they may have a little more empathy, but it can be variable because they're not getting the education about the differences in male and female, same as a male physician is not getting. So and the world is changing,
Yes.
more metrosexual, men. So we are finding more. So I would rather bring that education piece to both male and female physicians. And then that gives more the ability to connect with the patient, being that safe space for the patient. Now, sometimes, female patients will say that they are more comfortable discussing certain issue with the female doctor, but the same goes for the male patients. They may say that, and it's the role of a provider to make the patient comfortable, that we deal with this every day, right? So whether it's male issues or female issues, we deal with this every day. We need to empathize. I need to bring the same empathy to a male patient about a male issue, right? If the male is asking for any sexually transmitted diseases, Viagra, or anything like that, how do the bias cannot come as much from my side as a male physician for a female related issue. But right now, yes, there is disparity where the females are, there is a pervasive gender stereotype, right? Men are stoic, the women are emotionally expressive. So it is easier right now, if I would say where is the education needed, it is in the female field for both male and female physician of how to look at the disease symptom and not be dismissive about it, because that is what is more a problem for
I was
both male and female.
if I could speak on that very subject, the absence of what I call emotional intelligence, which is that we are not just 30 trillion cells having a daily experience, but that we are consciousness, that we have sensitivity. Women more so, I think, than men, because of how the hormones, the estrogen versus the progesterone, the sensitization. And I will just say that I totally agree with you about the necessity of more education for doctors in general, not just specific to male or female, but just the whole area of understanding psychology, understanding sensitivity, understanding that your patient is more than a statistic. They are a human being, and they have a history, and they have a present. And the absence of understanding of that, particularly with women, can create triggers. It can. Again, it's more than just a function as a doctor. You're caring for a person who may or may not be physically at the top, but nonetheless, there are lots of other things that may be the cause of why they are where they are right now. If they have grown up with an abnormal home situation, which again, nobody likes to think that their home is abnormal. We have a standard in our head that says how I was raised was normal. Some people will say, not me, but the majority of us really do think we came out of normal environments, but we keep having these issues. Let me give you an example. African American women have a major issue with fibroids. I had them. My daughter's dealing with them both. And I believe that a lot of that is a direct result of stress. I don't have any validation, but I do know that given the fact that a large proportion of African American women suffer horribly, menstrual periods, physical distress, mental and emotional distress from bleeding all the time. These are not things that men have to deal with. If men have fibroids, please tell me. Okay. Like, do you have fibroids? Anyway, because of that, if a woman goes into a male doctor and she's having these problems, he can be clinical, well, this, that, surgical, blah, blah. But can he, or is he willing to open up that zone where maybe there's something else that's triggering this, or maybe there's something else that's going on, and engage in that inquiry? Are you following my thought process here?
Yeah. And so what I will say is in this women discussion, we also need to bring up cultural differences among women.
Ah, okay.
So
that's good.
Not only do we need to sensitize the physician community on what is the female male, but females are different in different cultures. So
tell me more.
Right?
Tell me more.
You have a patient who is more, say, maybe Asian. Now she's coming, say, from a highly patriarchal society. Now when she comes to a doctor, how does she not bring all her cultural baggage with her to the appointment?
Yes.
Same thing when you have an African American woman. The cultural differences there, whether it's in food, whether it's in the community, the way she was raised and the way the environment, whether it was, whether it was underserved area, whether it was, we are still dealing with a lot of mixed families, broken families. How does she bring that? And then how does a physician respond to the woman within the cultural and takes into account that cultural background? So, the generalization, even within the emotional, when we say women, when we are talking about, first of all, the physician's EQ, absolutely, right? But the EQ has to be relevant to the physician, to the patient in terms of gender and culture simultaneously. So that if a patient maybe culturally, maybe going through, say, for example, somebody's having fibroid, right? A lot of menopausal pain. One patient, maybe coming from a certain culture, is going to go through that, maybe having a 10 out of 10 pain, really bad pain. But she is suppressing because she's been told you can't be too expressive about it. So she has quiet about it, she's sitting quietly, but she's expressing in her own way. That's how she can do it. Versus another female from another culture is like telling the doctor, like, I am feeling this. And what are you going to do about it? Mm-hmm. So in both the cases, there is the woman with bringing with her culture, and somebody is going to be expressive in one way, somebody's another. And this is the area where the physicians right now are not well trained. So if when it comes to, because what is this fibroid causing pain, right? A lot of pain and discomfort. Pain is one of the number one area where there is gender gap.
Oh,
Even
wow.
if, yeah, even a patient goes for knee pain, physician is four times more likely to suggest a male patient for a knee surgery than a female patient. There is that, even basically believing that the female is having real pain is not this, versus a male. There is, because men are considered to be stoic, so if they express it, it must be real. But if the female expresses, oh, she's a drama queen anyway, right? This is what she does. So one is that, and then within the context of the culture also, there's a lot of differences.
I want
The
to
same thing.
I
Yeah, go
want to
ahead.
talk about this more only because the pain issue for women is major, major. And we have been culturally dismissed. Western culture has essentially said she's always complaining about something. And as I share with my male associates, if the stuff is hurting, what do you want? Okay, when you get knocked in a football game, somebody comes at you and bangs you up, and you get carried off the field and all this attention, I said that's considered a painful experience. I said, but for many women, childbirth is not only a painful experience, but many women are known to die. It's not just pushing out a child, it is also all of the things that have that occur during something like that. And yet you can't treat something perfunctory, because I do believe that the failure to acknowledge that this is a very serious, serious, serious occurrence should elicit a less than business as usual response, which is so common, which is, oh, she's having a baby. Well, you lay down and have a baby and watch your muscles and your bones cracking. You can hear them cracking, and you're just like, oh, I can't breathe. Breathe, breathe, breathe. I can't. This is every day. But and it's sad, because in my case, just as an anecdote, my doctor, with the birth of my third child, he took a cigarette break. He was gone. And I remember telling the nurse, if this buzzard wants to get paid, you better find him, because I'm getting ready to have this baby. And they were scurrying around because he was not on the hospital floor. He actually left. And I don't believe that a female doctor would have done that. I just don't.
Oh, I'll tell you a story on that. So, and this story is, of course, in India it happened. It was my classmate who's a gynecologist in India, female. And I was in the, she was delivering a baby, and OBGYN, and so she was delivering a baby, and I was visiting India, and so I was in the room with her. And the female was, the woman patient was not getting, she was screaming her head off. And this female doctor, my friend, had zero sympathy. And she was just like, just make her quiet, just make her quiet. She can't be screaming so much. And I was thinking about, of course, it was, we're talking about, I don't know if things have changed in that particular setting, but it was a city, but whether or not, but this was 10, 15 years ago. But I was just amazed of how little the pain was valued or respected. This woman was going through child labor. This is a female physician. And even then, the bias is so incredible that, and you're so desensitized sometimes, because you hear it all around you, like female just, at home have more drama, and at work more drama, and So that carries over where pain is not. So these are the two areas, right? Pain is where females in all the research say they feel unheard. So whether it's endometriosis pain, it's pain in migraines, the convincing is, it's very hard to convince a provider. And the other is the chest pain, the cardiac care, because females don't present. Now when we talk about physiology, female may not present with this, this idea of like there's something sitting on your chest and it's a substernal chest pain radiating down the left arm. That's a classic chest pain. One way of defining it. But a female, I had in my couple jobs before this, there was my secretary, and she started with this tooth pain, and she felt like it was just a tooth pain, and it just kept getting worse. And then that evening, when it got so bad that she ended up calling one of the physicians. We were in a private group practice, and so she ended up calling one of the physicians and then passed out. Turns out it wasn't a tooth pain; it was a heart attack she was having.
Oh no!
Yeah, so it is so easy to dismiss that. And these are the two areas where there is a lot of dismissal of female patients and not getting adequate. So it is a serious issue that needs to be taught in medical school. And I was sharing with you before this, right, that and now this is the data in UK, that only in this year, in 2024, will it be compulsory for the general practitioners to have a training in women's health. So it's interesting that it is taking this long for for the medical community to even respond, and still it is far from adequate amount of training for and recognition and bringing that awareness into it. But that's what's needed, and that comes also then from the female side to, we need to educate through your channels and other mediums like this. How do we present differently? So, and how do we advocate for ourselves? How do we speak up? It's hard enough in the medical community to get your voice heard, right? It's not it is pretty rampant, right? Because whether you talk of male or female, it is pretty rampant where things can get dropped sometimes because of the volume, because of the time constraint, whatever. But then with the female, how do you become more of an advocate? Don't have this absolute surrender kind of thing with the doctor. Don't have this absolute okay, I'll do whatever the doctor says. If you are having a sixth sense, if you're having that intuition, like something is wrong, chase it. Because chances are you are thinking right. So while we are working on the physician community to educate, right? But for us to understand our bodies, to know that, like, I'm always educating my female patients, right? Those who have heart, like, hey, don't wait for that substernal chest pain. It could be a jaw pain, right? It could be a back pain for you. It may never be a chest pain for you. So don't wait for the classic symptoms for you to go to the doctor. So understanding that part.
That's very, very good advice, because particularly as you get older, the body just begins to fire off pain signals. And I've never had to deal with migraines, mainly because I don't eat meat. And I really do believe that meat is a trigger. I just do. The steroids in the meat trigger a response. But again, I'm not a practitioner, so I can't speak to that. But I do know that for women, and I say this for the benefit of all of my women and men listeners, women, you need to advocate. You need to advocate. You need to not be dismissive. It may cost you your life. And so what are some of the things that you think, Dr. Singh, women, when she gets up in the morning, give me a standard routine that a woman can easily put into place for herself. So she sleeps, hopefully she slept restfully, because a lot of people don't. But alarm goes off, 6 o'clock, ding, ding. So give me a typical situation which shows self-care for her.
Okay. So when you wake up in the morning, of course, I recommend every patient, male or female, to do some stretches right on the bed. So don't just wake up, sit up, do some forward bending stretches on the bed, side bends, make your spine a little more active before you get out of bed, center your mind a little bit. If you are in whatever be your religion, non-religion, whatever your spiritual beliefs are, just centering, bringing a little bit of like gratitude to your start of the day. And then when you feel a bit, get out of the bed, put your feet, it's always recommended to, start, turn your body, turn your feet down and then stand up, feel the ground, get grounded. And then, as you are from starting your day, then we're talking about in shower, make sure you are doing your breast self-exam for women. So feeling the breast, you know your breast, know where the lumps are, what feels normal. So at least once a week, you are just doing a breast exam. And after, I recommend, of course, not using in the shower any soap. Not only I recommend, that's recommended. Like no soaps or anything in your private genital area. That'll give you an infection. So none of that. Bowel movements in the morning is great to have, right? You're brushing your teeth. Tongue cleaning is important.
Yes.
So that a lot of people tend to miss, but that's the toxins can build up on your tongue. So these days, people should know tongue cleaner should be part of your routine in the morning. And then having a glass of water, whether you are having a glass of plain water or, you have your own routine of, lemon water, lemon and honey, warm water, something like that to get your digestive system going. And that should be a good start of the day. In your day, including, having your day where you're not skipping meals, breakfast being like a breakfast. So it's not like the largest meal of the day. It is breaking a fast is called a breakfast. Mm-hmm. So you have had a fast for 8 to 10 hours at night, if not more, depending on what your routine is. In general, healthy routine is, at least minimal of 8-hour fast. 10 hours even better, right? You're giving your GI system a rest, your liver, all the food that you're eating all day long is going through your liver, metabolize. So you need to give your liver a rest at night so that your blood flow can go then, because when you eat food all day long, the blood flow goes to the GI system to help digest the food. So when you give a break, the blood flow goes to the brain, and then the brain gets rejuvenated. So all the nighttime hormones then, that are needed, growth hormone, which is needed for metabolism, all of that require a good blood flow. So when people are having midnight snack and not giving long enough, then, then they suffer from low metabolism, partly because the pituitary hormones are not getting released properly at night. So that blood flow happens, and then you break the fast. So your meal in the morning is sufficient, but not a lot of it. Never start your morning just with coffee. It'll give you acidity. So you need to eat something with your meal. I know it's culturally, a lot of people just start their day with coffee and then they wonder why they suffer from acidity, right? Prilosec is one of the most common medications used worldwide today. Then, so while there are benefits to coffee, maybe, but not before breakfast. So
what
then
about,
you
what about herbal teas and that type of thing? What about that?
Herbal tea, as long as caffeine first thing in the morning, a lot of herbal teas, if they have caffeine, then I would delay it to after at least eating. Now the herbal teas, there are teas that are made from, say, like cumin and fennel, and that's fine. But if there's caffeine in it, so like one of the greatest tea because I'm also an Ayurvedic counselor, is like it's called the CCF tea, the cumin, coriander, and fennel seed tea. So you put a teaspoon of each, and then you boil it in water. That's you can have it first in the morning. It's like a detoxifier for the entire body. You can have it in the body, the CCF tea. But other
Say,
than
can
that,
you
like
say that again? Because that's
CCF,
something I didn't
yeah,
know. That's called
yeah. The
coriander.
cumin seed, yes, yeah, coriander, cumin, and
Okay.
fennel.
And fennel. And you boil them.
You take a teaspoon of it each, and then you put it in the water, like 2 cups of water, and you boil it down to 1 cup, and then you drink it. It's like a detoxifier, diuretic,
I
alkalizing. Imagine, coriander is alkalizing, fennel is alkalizing. Having that every day,
I
1 to 2 cups.
I did not know that. I didn't know that I could mix all three of them together. I have the fennel, thanks to you. I have the
Mm-hmm.
coriander, and I have the cumin, which I got
Mm-hmm.
in Morocco. Yeah, I kept it sealed. It's still very, very effective.
Yeah.
But I did not know. So that is in the morning and not at night.
Well, you can do, but night, you may do want to do it in the evening because then it'll may be a little diuretic, so you don't want to have it at before bedtime.
I got you.
Um, yeah, but CCFT, so it's called the CCF, like C for coriander, C for cumin, and F for fennel. So it's one of the powerful alkalizing, making your body, because we're eating so much food, like bread is acidic, right?
Yeah, it
Your
is.
pH of the body should be alkaline. Your coffee is acidic. Your whatever, your pasta is acidic. Your tomato sauces in their pasta is acidic. Your burgers are acidic. Your Coke is acidic.
Uh,
So you're having so much acidic food all day. So keeping it alkaline, because it is an alkaline environment that cancer cells don't grow, right? So we want to keep our body alkalized as much. Sugar is acidic. So, so in general, alkalizing the body is what is, of course, recommended.
so can I
So
ask
then
a
you go,
question? Can
yeah,
I ask? Can I
yeah.
just interrupt?
Yes, yes, yes,
So
please.
we know that the body's healthy state is alkaline, and
Mm-hmm.
we've got all these things that essentially turn the body or the gut acidic, which
Mm-hmm.
explains tummy burn and everything else. Um,
Mm-hmm.
so based on that, what you're just sharing with me, um, is a good breakfast. You take this CCF, no
Mm-hmm.
sugar. What about honey? Can you do honey?
Yeah, you can do honey. Yeah, you can do honey. Honey should never be put in a boiling water. So you have to
Okay,
strain it. And then when you need to put the honey in when you're ready to drink it. So
okay,
honey should never be, because then it denatures the honey.
okay. That's good information. So your actual breakfast should typically consist of what?
Your breakfast could be, well, again, I would call it very culturally. It can vary from one culture to another. So I have healthy breakfast cannot be defined in one way.
Okay,
So within the cultural framework, every culture has healthy breakfast. So what should not be done is what I can suggest. For example, oatmeal, great breakfast, right? But you don't want to overdo the oatmeal, right? Because then that will have cause. Sometimes people will feel like tired right after having oatmeal because it can be a higher glycemic index if you have put too much, higher glycemic load if you have put, your too many fruits in there, and so then you feel a little down. So smaller portion of your oatmeal is great. And then you can have, if you're having a piece of wheat bread, for example, if you want to have that, depending on what you eat, if you are eat eggs, if you are eating eggs, you can have an egg. You want to limit, egg yolks, for example, right? There is all kind of literature. Oh yeah, you never have egg yolk. Then there's like, oh, have one egg yolk every day. My experience has been that, egg yolks in general for my patients, senior patients, 3 egg yolks a week is pretty plenty. Whenever they go up, I will see that LDL start climbing. So, yeah,
So
so there
you're saying 3 eggs a
three egg
week?
yolks a week. Yeah,
Okay.
egg yolk. So
The
if you can
yolk,
have,
not the white.
yeah. Now, egg white is acidic, so you have to be mindful. You can't have like 5 egg whites in the morning, which a lot of people with gym going people will start doing, right? Like, I'm just going to have egg whites. Well, but that's acidic. So now you had, if you have egg whites and the bread, so then everything and coffee, now everything is acidic. But if you have like, and say suppose you're having egg, but make sure you make it into an omelet, right? Put some spinach in there, and cilantro leaves in there, some peppers in there. So make, because your fruits and vegetables are alkaline. All the fruits and vegetables are alkaline. So go ahead and throw that in your egg. So you're balancing the egg, right? Egg is acidic, you balance it. Yolk is less, it is acidic than the egg white, but still, because you're having, say, maybe half a yolk in an egg, or you're doing only egg yolk 3 times, well, balance it. So put some vegetables, so make it into a healthy omelet with a toast of bread. Don't go for 2 toasts of bread and just plain egg. Rather make an omelet with 1 toast of bread. Avoid sausage and stuff in the morning, right? Because then that is all, meat is all acidic. Starting your day that heavy, it's, I know, again, culturally done, right? But starting your day like that is, and why do people do it? They do it because it's protein. There are other sources of protein that you can use, whether it's tofu, any kind of beans, chickpea. I have even seen people, I went for a retreat in Colorado, and our breakfast used to be quinoa with all the, it was
Oh,
wonderful. Oh, I loved
yes.
it. It was quinoa with like chickpeas and some. Oh, and then, yeah, every day it was a retreat. It was, I think they only, I don't remember if they had meat in there or not, but it was a very healthy retreat. So,
Well,
uh,
which brings up another issue with myself, as I look at women and the whole what begins to happen with their bodies because of poor eating habits, eating on the run, not getting enough sleep at night, dealing with stressors regularly, and I think, doctor, that a predominantly plant based diet, which I have lived with for over 20 years, um, is essential to maintain health and to keep from getting so large. Because in the African American culture, a big woman is not considered a negative. Now, as I tell people, because I do insurance, a big woman is a problem because the industry has guidelines and you will find yourself unable to get insurance due to your weight, height, and your body mass. So, do you feel that as a part of women's health, they need to focus much more on eating greens and fruit and plant-based items, like even, veggie burgers, avocados, fresh stuff, rather than so much processed stuff? And now this ultra processed stuff, which isn't even food, it's just mush put together and you eat it. Like your hot dogs, folks. Yeah, like your hot
yeah,
dogs.
no, I absolutely agree. Plant-based diet is the way to go. So there is no question of the benefits of plant-based diet. A lot of my patients are unable, especially women patients that have eaten meat all their life, are unable to change to plant-based because they just love the taste of it. What I suggest is either start with 1 day plant-based, and then move on, find options for that day, and then try to do 2 days plant-based. If you are doing all 3 meals, have one meal has sausage and your red meats and the chickens and fish, move over to at least making one meal plant-based. So gradually move in that direction. But you are absolutely right, right? From the environmental standpoint, And from the health standpoint, the effects of eating meat are rampant. Everybody today is dealing with hyperlipidemia, which is high cholesterol, and meats are, known to cause that. So it is considered like, oh, everybody has it. No, not everybody
Not
should have it,
everybody,
right?
no.
It's not. But there are cultures, and I was just watching a documentary recently in last 2 3 weeks that you mentioned. There is this town in Mauritania, and they're very unique where because big girls are what is considered attractive for them to get married. So these Mauritanian girls are forced to swallow gallons of milk, couscous, peanut oil, cups of pure animal fat just to get them overweight so that they can get married. And then recently, more and more has come out. There is actually a women's movement in that town against it, where the women are now educating their community about how this is not good for the woman's health and should not be propagated where unnatural amount of weight. And we know if somebody wants to counter argue and say, well, but this is natural. Well, if it was natural, then the a woman or the man would not feel excessive amount of joint pains from that, would not develop hyperlipidemia from that, would not develop, all the diseases from that. So the fact that we are, if when we are overweight and obese to that extent, we are contracting diseases related to that. That tells us that that's not a natural state. So we are not, an elephant is big,
Yes,
right? So
yes.
an elephant is naturally big. So the elephant, when they're naturally big, they don't contract diseases because they are big, but we do. Or rhinoceros is big, but they
Right.
don't contract. So whatever, a cow grazes all day and is, big, but the cow is that's in the natural state.
Yes.
For us, if it was natural, and the same thing with the plant-based diet, right? We can have a lot of raw food, raw plants, and that is one of the things I say for people on the go. Your bag should be full of bananas, things that you can just peel and eat, oranges on the go, in the car you can eat, carrots, cucumbers, things that are not even full on salad because you're on the go so much that, I sometimes have to eat, between meetings. So then I'm like having a banana, peanuts, nuts, carrying some nuts, Brazil nuts, right? It's so great for thyroid. So having a Brazil nut today. So your prunes, dried prunes in your bag, dried apricots in your bag. So things can be done. But if you think about our diet, we can eat raw plants and vegetables in our diet. People will have, but we can't eat raw meat.
No.
So we can't just like a lion, grab a meat or even a dog and just eat it or a eagle, that eats it. Why do we have to cook meat? Because it is not a natural state. Otherwise, we have not been given teeth that we can just bite into
Right.
something and
Right.
so that tells us something. We are very intelligent human beings. So we are the only species that has got this invention ability, right? We are inventing things, we're inventing pressure cookers and but then we have become our own worst enemies, right? So that's why we have been able to make the meat softer for us to be able to eat. But is it natural? Definitely not.
No.
And it's showing
No.
in the
No.
body.
Well, if I might interject and just simply say that this is one of my true challenges because women have to get a hold of this weight thing. And it cannot be up and down, trying this diet, that diet. It has to be a lifestyle. It has to be a decision. And one of my dear friends who is now deceased, Miss Lewis, Rachel Lewis, who was a vegetarian, even though she had a restaurant and fed people meat, but she says that we are addicted. She feels that the reason people cannot change their diet to something that's healthy is because our cells are addicted to this horrible stuff, and to try to change throws them into withdrawal, which is they actually begin to act out. And I see it so much. I see people struggle and have to go through bariatric and procedures to get their stomachs cut. Even though the failure rate is very high, they go right back to getting big. So we've got a lot going, particularly as we look as females. But can you summarize, because my producer said we are done, doctor. Can you summarize just the key things that women need to know about their health, starting with doctor selection? Can we go through that real quick and then we'll conclude?
Yes. So from the doctor selection, make sure that you are looking up the doctor on the reviews to see do they have a listening ability, right? So make sure that you are Googling the doctor. Today we have Google. And we need doctors to listen more and be open, and just see the ratings. That'll help. When you go in to see the doctor, please do not be afraid to ask some questions, like how do they are they open? How do they deal with female issues? Let the doctor understand where you are. Women are sometimes very embarrassed about being an advocate for self more than men, right? Whether it comes to pay, right? Same thing with the pay disparity, or when it comes to health. So be open, be honest, take a relative with you, and so that, because if you are tongue-tied in the moment, it helps. Even I got tongue-tied, when I was going through my treatments, and it was like really helpful to have my partner with me. So just take your loved one with you or a friend with you. Take some notes. Write down some questions. Be respectful. There is nothing disrespectful about asking questions, but get the satisfaction. It's okay to do a little doctor shopping if you're not happy with your first doctor, and don't feel guilty about that.
That's
When it
good to
comes to
know.
your symptoms, and then when it comes to your symptoms, make sure that you are sharing your symptoms with not dismissing your own symptoms. I had a patient yesterday actually who came to see me. She was having this substernal chest pain. She woke up with it, a lot of chest pain, and then she dismissed it. She's like, and she said, that's what I do, all about my symptoms. And so it was interesting. And she's a healer, so she's in the community. So it was very interesting that how we dismiss our own symptoms. So don't be dismissive of your symptoms. If you're having a symptom, be objective about it and share what you're feeling, how long you've been feeling, and also what you are thinking might be going on. Be sure to share your family history. It's very important for us sometimes to know the context. If your daughter came in, Michelle, and said, my mother has fibroids too, that'll, make the antennas go up for the provider. So that's what I would say from the patient end. Do that, and then in terms of diet, sure, you are absolutely right. All these fast food, they have MSG and casein, which is addictive. So it is. Your friend was right. It can get addictive. So be gentle on yourself, start making changes, but one change at a time. No more than, we say 1 or 2, never 3. So start with small changes, be kind to yourself. If today you're having 3 meals with meat, cut down to 1 meal out without a meat. Sorry, if there was a meat, add some fruits and vegetables. And just be self-care. You can't take care of the world, which is what women are guilty of. They start taking care of the world without
I
taking care of
know we
themselves.
do. But listen,
We
our
do.
time is up. And it has again been a joyous occasion. You've given us much information that we can chew on, practical, realistic information from your perspective as I call you that new generation of aware medical professionals. And thank God you're in my life. I just have to say that. I so appreciate your transparency and your willingness to help women. Viewers, this has been enjoyable. We have had as our guest today Dr. Anisha Singh, who is over a number of senior medical centers, and her credentialing is very, very impressive. You can Google her to find out for yourself. And again, I thank you for being my guest. Looking forward to us doing this again in due season. And you have a very pleasant day, and we'll talk soon. Okay?
Thank you, and
You're
don't
welcome.
forget your CPFP.
Oh, I'm not. I'm dealing with that today. Okay, thank you so much.
Thank you.
Love you so much. You take care. Bye-bye.
Okay.
And until next week, next session of Power of Money with Michelle Graves, your money lady, because it really is about health, because you will not have wealth if your health is poor. Okay, it doesn't work. It just doesn't work. You got problems. Ask all of the older people. They saved and they saved and they saved, and now they got chronic conditions that are costing them everything. You don't want to be among that number. Take care of yourself. And until next time, God bless you so much. Bye-bye.